So my name's Tracey Clusker and I am the nurse consultant working with Public Health Scotland, and my role is to support alcohol drug partnerships and justice services to implement the 10 MAT standards across Scotland. In 2019 the Drug Deaths Task Force was established, chaired by Katrina Matheson, and as part of the work of the Drug Deaths Task Force was to look at a response to drug deaths in Scotland. Scotland does have, by head of population, the highest drug death rate in Europe, and with the lowest amount of people in structured treatment across Scotland, England and Wales. So whilst we have high numbers of people using drugs problematically, there were very little numbers of people accessing structured treatment. Structured treatment for problematic drug use is a protective factor against drug-related death, so we wanted to understand why, firstly, people were not wanting to come into treatment in Scotland, and secondly, how do we make treatment more attractive and what do people want from treatment. Other areas of medicine do have standards of care, so you will have standards of care for other areas of medicine, for cancer treatments, hepatitis, but there were no standards of care for people who were using drugs problematically in Scotland. So Duncan McCormack, Public Health Consultant, chaired a group that was named the MAT Standard subgroup of the task force, and part of the work from this subgroup was to develop a set of standards and a framework for areas across Scotland to follow and implement to provide a quality of standard of care for people to access services. As part of the work that was undertaken, we were wanting to look at initially standards of care for receiving not just medical treatment but psychological treatment to recovery support, ensuring treatment was trauma informed. Now, whilst there was 10 standards of care, I think it's really vital to mention as part of the development of the standards that there's clear indications of what people should expect from treatment. So if you're a person accessing treatment, what you should expect from that treatment, and if you're a family member wishing to access treatment for a loved one, that you can know clearly what standard of care that your loved one should receive, and that you're entitled to care in your own right as a family member. As part of the development of the standards, we were really keen that those with living experience and family members were involved in the consultation and the final write-up of the standards of care, and there was a huge consultation phase to try and make sure these standards did meet the needs of the population in Scotland.